Hello all, I am Dr. Vishwanath S, Consultant Medical Oncologist with Apollo Hospitals, Bangalore, and I'm here today to talk about certain myths which our patients have about lung cancer. The first myth is that only smokers can get lung cancer. This is again very strong misconception which patients have, and yes, over the last 4 or 5 decades it's always been like smoking is equal to lung cancer, but it's not true. There are various other factors which can also lead to lung cancer, like second-hand smoke or passive smoking, and then third-hand smoke where the smoke is kind of, and the carcinogens are all hidden in the furniture and on the walls of the rooms. And this third-hand smoke also has got carcinogens that also can lead to lung cancer. And long story short, there are several factors apart from smoking which can cause lung cancer. Now, the second misconception which our patients have is there's no point quitting smoking and it does not change the risk associated with lung cancer. The point remains that it's never too late to quit smoking, and even after say you quit smoking after 10 years, the risk of having a lung cancer later in life keeps coming down. It may not become like an average individual who has never smoked, but the risk of having lung cancer once you quit starts coming down. The other misconception which people have is that only men can have lung cancer. That is again total myth. In fact, in our practice, I see almost like 3 out of 10 patients who I see with lung cancer are women, young women, non-smokers getting lung cancer. So it is catching up even in women, and what is alarming is that these women would have never smoked. So it's probably the other factors which are responsible for them getting the lung cancer. Now, the next misconception is about age. People think that only older men or women can develop lung cancer. Again, this is a common misconception. And yes, cancer was considered previously that it is a disease of the old age, but due to various factors including our environmental pollution, we are seeing several women and men, I would say in the younger age group, in the 40s, 30s, who are getting lung cancer. Now, the next myth is about screening. Screening causes lung cancer. That is the myth. So, screening for lung cancer is done in only a subset of individuals who have smoked for the last 20 years, like 1 pack a day for the last 20 years, and who are over the age of 55 years. Only in this subset of patients or individuals we do screening for lung cancer, and it is done with low dose CT scan of the chest. Now, people think that this low dose CT scan of the chest can cause lung cancer because of the radiation associated with CT scans. To state the fact, low dose CT scan gives very little radiation to the individual who is undergoing the CT scan, and that much of radiation we would get from background environmental radiation, and that is definitely not going to increase the risk of having a lung cancer. And definitely, if you look at the benefits and risks associated with undergoing a low dose CT scan, especially in these individuals who have been smoking for the last 20 years, the benefit is much more as compared to the risk. So it is important that these individuals undergo low dose CT scan of the chest. Now, the next misconception is about all lung cancers are the same. In fact, 20 years back, we were probably saying that lung cancer is only of 2 different types, called small cell lung cancer and non-small cell lung cancer. But there's been so much of advancement in the field of pathology that we are able to say that there are so many different types of lung cancer and so many different types of non-small cell lung cancer based on the microscopy, when the pathologists look onto the slide, and based on several molecular markers, we are able to stratify these lung cancers into so many different subtypes. And not only that, the treatment has become more personalized and unique to that patient's specific tissue biomarker. An example of this would be a simple mutation or genetic defect which is called EGFR. Now, EGFR mutation or genetic defect occurs in 60 to 70% of individuals who have got lung cancer, and especially non-smokers and women. Now, we are able to treat them with simple targeted therapy or oral pills. These are also called magic bullets, and these patients are living long. It could be another individual who does not have this biomarker called EGFR, and that patient may have to receive what is called as conventional chemotherapy. The fact remains that not all lung cancers are the same, and it is a misconception, and the treatment, diagnosis, and the symptomatology, everything is quite different in these individuals.